Imagine this scenario for a moment. A situation so perplexing, so persistent that it defies all conventional explanations. A man, seemingly in the prime of his life, his 30s, walks into a medical clinic seeking answers to a problem that has plagued him for as long as he can remember. He's been battling a lifelong blocked nostril, a constant companion that has shaped his daily existence. It's more than just a minor inconvenience. It's a persistent obstruction that affects his breathing and overall well-being. Adding to his woes are a frustrating loss of smell, diminishing his ability to enjoy the simple pleasures of life, and constant nagging headaches that seem to have become a permanent fixture. He's diligently tried every treatment imaginable, nasal sprays of all kinds, countless pills, each promising relief but ultimately failing to deliver, and a whole arsenal of allergy medications. But despite his best efforts, nothing has worked. He's trapped in a cycle of hope and disappointment. Today, the pressure in his sinuses is worse than ever, a throbbing ache that intensifies with every passing moment. And to make matters even more unbearable, a foul, persistent odor imperceptible to everyone else has taken hold, a phantom smell that only he can detect. The doctor, a seasoned professional with years of experience, senses that something is truly unusual, something beyond the typical sinus complaints. He decides to employ a more advanced diagnostic tool, an endoscope, to get a closer, more detailed look inside the nasal passages. On the monitor screen, the magnified view reveals a landscape of the nasal cavity, a world unseen by the naked eye. But what he sees isn't the expected swollen tissue or excessive mucus. Instead, it's a large, unusually hard, grayish-white object, an anomaly that immediately captures his attention. It's wedged deep within the nasal cavity, firmly lodged in place, an unexpected and unwelcome guest. The doctor is visibly stunned, his years of medical training struggling to reconcile with what he's seeing. The patient, oblivious to the extraordinary discovery, is about to finally learn the true cause of his long-standing misery, a rhinolith, more commonly known as a nasal stone. This rare and unusual calcified mass has been slowly growing, imperceptibly accumulating minerals for an estimated 25 years, a quarter of a century. Layer by layer, like the rings of a tree, each one representing a period of growth and accumulation around a tiny foreign object likely lodged in his nose during childhood, a forgotten incident now having significant consequences. The doctor carefully explains the situation. It's not allergies, nor is it a deviated septum, the usual suspects in cases of nasal obstruction, but a stone, a physical object, that, while unusual, can be surgically removed, offering a definitive solution. For the first time in what feels like an eternity, the patient has a real, tangible answer to his suffering. Years of dismissed symptoms, misdiagnoses, and failed treatments now suddenly make perfect sense, the pieces of the puzzle finally falling into place. A wave of relief washes over him, a sense of lightness he hasn't felt in years. Because this is a tangible, treatable problem, not some mysterious, untreatable condition he's destined to live with forever. The path forward is now clear and well defined, surgery to remove the offending stone. The realization is profound and somewhat surreal. He's unknowingly carried a forgotten piece of his childhood, a silent stowaway, inside his head for decades, impacting his health and well-being. The journey to this pivotal point was undeniably long, arduous, and filled with frustration. But now, for the first time since that long ago childhood incident, there's genuine hope for a breath of fresh, unobstructed air, a chance to finally experience the simple joy of breathing freely. The doctor meticulously prepares him for the next crucial steps in the process, outlining the surgical procedure and what to expect. The patient is understandably both shocked by the unexpected nature of the discovery and profoundly relieved that a solution is finally within reach. The perplexing mystery of his chronically blocked nose, a puzzle that has stumped doctors for years, is finally definitively solved. A new chapter, filled with the promise of improved health and a better quality of life, is about to begin. Sometimes the answer to a complex medical problem is hidden in plain sight, overlooked for years despite its persistent presence. And sometimes all it takes is a fresh perspective, a new diagnostic approach, to finally uncover the truth and set the stage for healing. If you found this video informative, please like, subscribe and share for more such content. Let's call our patient John. It's a common name, and his story, while unique in its specifics, touches on a universal experience of enduring a health issue that significantly impacts quality of life. Since the tender age of 5, John's right nostril was perpetually stuffy. It was a constant companion, a nagging presence that colored his everyday experiences. Doctors, in their initial assessments, attributed the problem to allergies, a common culprit in childhood nasal congestion. They hoped he would grow out of it, as many children do. But time marched on, and the stuffiness persisted. The blockage became his constant companion, a frustrating and unwelcome guest that refused to leave. It was more than just a minor inconvenience. It was a barrier to fully experiencing the world. He struggled to focus in school. His attention constantly pulled back to the discomfort in his nose. The simple act of breathing became a conscious effort, diverting mental energy from his studies. He was a mouth breather, a habit that drew unwanted attention and made him feel self-conscious. This led to feelings of social isolation, a sense of being different from his peers. Sports were tough, his stamina was limited, and he couldn't keep up with his friends. He couldn't breathe properly during physical activity, and to add insult to injury, he was often teased for his nasal voice, a constant reminder of his breathing difficulties. In his late 20s, a foul smell developed, an embarrassing and persistent odor that seemed to emanate from within. This unpleasant smell made him withdraw even more from social situations, further compounding his feelings of isolation and self-consciousness. He missed out on the full taste of food, the subtle nuances of flavors lost to his diminished sense of smell. He longed for the simple pleasures of life, the invigorating scent of coffee in the morning, and the deep restorative benefits of restful sleep, all of which were compromised by his persistent nasal congestion. Sinus infections and headaches were routine, a recurring cycle of pain and discomfort that further eroded his quality of life. He tried every decongestant and nasal spray he could find, desperately seeking relief from his chronic congestion. But nothing worked, offering only temporary respite before the blockage returned with renewed force. Over time, John adapted, learning to live with his limitations and adjusting his expectations. He resigned himself to living with one working nostril and a world of muted sensations, accepting this diminished reality as his new normal. He accepted this as his normal, never suspecting that there was a hidden cause, a tangible reason behind his decades-long struggle. The real problem wasn't allergies or a cold, as doctors had initially suspected. It was a physical object, something concrete and identifiable that was obstructing his nasal passage. This object had been hiding in plain sight for decades, a silent and persistent intruder that had shaped his life in profound ways. His life was shaped by a forgotten childhood moment, a seemingly insignificant incident that had long been buried in the recesses of his memory. The world of clear breathing and the vibrant tapestry of smells was just out of reach, a tantalizing possibility that remained frustratingly beyond his grasp. Until now, as the pieces of the puzzle finally begin to fall into place, revealing the truth that has been hidden for so long. Enjoying the story? Don't forget to like, subscribe and share for more medical mysteries. How does a stone grow inside a nose? It starts with a nidus, a foreign object, often from childhood curiosity, lodged in the nasal cavity. The body tries to flush it out with mucus, but if it stays, minerals slowly coat it layer by layer like a pearl. Over years or decades, the stone grows, shaped by the nasal cavity. The blockage causes chronic inflammation, infection, and a foul-smelling discharge. The process is slow, so symptoms creep up unnoticed. Eventually, the stone becomes large enough to cause major problems. The classic signs: one-sided blockage, persistent smell and pain. It's a rare but remarkable example of the body's response to a foreign invader. If there's a rock in someone's nose, why isn't it found sooner? Rhinoliths are rare, and their symptoms mimic common issues like allergies or sinusitis. Doctors treat the usual suspects first. Few think of a nasal stone. Routine exams often miss it. The stone hides behind inflamed tissue. Only advanced tools like endoscopes or CT scans reveal the truth, but these aren't used for every blocked nose. The key clue: symptoms on one side, persisting for years. Most doctors don't connect the dots unless the history is unusual. For John, The unique combination of symptoms and timeline made his case stand out. It's a classic medical puzzle, obvious only in hindsight. Sometimes the rarest answer is the right one. Once the rhinolith was found, surgery was the only option. The stone was too big to remove whole, so the surgeon broke it up and extracted the pieces endoscopically. The process was delicate, avoiding damage to the nasal structures. Piece by piece, the stone was removed, revealing raw, inflamed tissue beneath. The cavity was cleaned and checked for damage. In John's case, the septum was intact. After 25 years, the secret was finally gone. If you learned something new, please like, subscribe and share this video with your friends. The most fascinating part? Discovering the nidus. Inside the stone's core was a tiny blue plastic bead, a forgotten childhood toy. John vaguely remembered playing with beads as a child, but not the moment it went up his nose. That fleeting act led to decades of discomfort. It's a common story. Beads, seeds, buttons, even erasers can become rhinoliths. The object itself is harmless. Its presence is not. For John, seeing the bead was closure. The mystery was solved and healing could begin. The moment the surgical packing was gently removed, after weeks of anticipation, marked the true beginning of John's new life. It was the culmination of a journey, a turning point he had longed for. John took his first truly clear, unobstructed breath in what felt like an eternity. 25 long years. Air rushed in, filling his lungs with a sensation he had almost forgotten. The sensation was overwhelming, a tidal wave of relief and emotion washing over him. It was more than just physical, it was a profound emotional release. Air, crisp and clean, filled his senses. The world opened up as his sense of smell, dormant for so long, began to awaken. And taste returned in vivid detail, each flavor a revelation, a symphony of sensation he hadn't experienced in decades. Food became an adventure once more. The foul odor that had plagued him for years vanished, like a dark cloud dissipating in the wind. It was replaced by the clean, invigorating scent of fresh air, a constant reminder of his newfound freedom. Sleep improved dramatically, becoming a restful and restorative experience rather than a nightly struggle. The constant, nagging headaches that had been his unwelcome companions for years simply disappeared, lifting a heavy weight from his shoulders. And his voice, once muffled and nasal, lost its distorted quality, becoming clear and resonant. Confidence returned, blossoming from within as he rediscovered himself. He joined a running club, eager to embrace physical activity and connect with others, and embraced life with a newfound enthusiasm, seizing every opportunity and living each day to the fullest. The transformation was dramatic, a complete rebirth, a testament to the power of healing. It was a holistic healing, encompassing both physical and psychological well-being. John's story serves as a powerful reminder of the profound impact a correct diagnosis can have on a person's life. His problem, though debilitating, wasn't some mysterious ailment or incurable disease. It was a simple mechanical issue, a physical blockage that was preventing him from living a full life. Once the obstruction was removed through a precise surgical procedure, his body, resilient and eager to heal, recovered quickly and remarkably. He was finally freed from a burden he never truly knew he carried, a silent weight that had been holding him back for decades. The change was nothing short of life-altering, a transformative experience that reshaped his world. Sometimes, the simplest solution, when applied with precision and care, brings about the greatest and most profound relief. And a new life, a life filled with promise and potential, begins with a single, clear, and liberating breath. John's story offers lessons for everyone. The biggest red flag, a persistent, one-sided nasal blockage that doesn't respond to treatment. Add a foul-smelling discharge, recurrent infections, or a history of childhood nasal trauma, and suspicion should rise. Early detection can prevent years of suffering. If you see these signs, think beyond the usual suspects. Sometimes, the rarest diagnosis is the one that matters most. For doctors and students, John's case is a lesson in curiosity and persistence. Don't accept old diagnoses without question, ask why, and look deeper. Listen to the patient's story and use the right tools when symptoms don't fit the usual pattern. Diagnostic momentum can blind us. fresh eyes can solve the puzzle. John's relief came from careful listening and critical thinking. Your miracle drug. Remember his story. Never stop asking why. Sometimes the answer is simple but life changing. And that's the true art of medicine. Thank you for watching. Like, subscribe, and share for more such informative videos.